Okay, let me go over with you supplies, because this is something that a lot of students kind of freak out about. Do I have to know all the supplies? And the answer is yes. But don't overcomplicate them, okay? Everybody knows what you need to brush teeth, right? You need a source of water, you need toothpaste, toothbrush, and a place to spit. And we do this right over the sink, right? That has water and a place to spit. So all we think of is toothpaste and toothbrush. But when you break it down to its real elements here, you need a source of water, toothpaste, toothbrush, and a place to spit. Well, when a patient is in bed, that adds just a small level of complication to it because they're sitting up instead of leaning forward. Think about you when you're brushing your teeth, right? You usually lean over a sink or something for things to drip down. If somebody's sitting up in bed, that's not going to be overly effective. They're probably going to drip on them. So we might want to put a towel or something to cover their clothing and catch anything that might potentially drip out of their mouth as we're brushing. So let's add to a source of water, a place to spit, toothbrush, and toothpaste. Let's add to that a towel. Now, we are going to be the ones that do this on the patient, and that means that our glove rules say if we're going to come into contact with anything ooey gooey that didn't come out of us, we need gloves. So in this case, we're dealing with saliva. That means that we need gloves. So let's add gloves. So we needed toothpaste and toothbrush. We needed a source of water and a place to spit. We needed a towel and now gloves. And then we need somewhere to put all of that stuff. And we know that somewhere is going to be a barrier. So let's add in a barrier. So instead of trying to memorize this random list of words, make it make sense to you. These are all very common sense supplies that you would need if you were going to brush somebody's teeth who can't get to a sink. So the same thing with all the other supplies that we're going to learn along the way. But again, try to make this make sense to you. So when you're thinking about the supplies, put them in a logical manner. And again, like I said earlier, you have them in your skills book. On the skills page, all of the supplies are listed. And you also have in the flashcards, you have supplies. And on the back side, it tells you the supplies that you need for that particular skill. So these can be a handy resource for you as well if you didn't want to make your own. So you can go onto my website and pick those up if you'd like. All right, so now that we have done mouth care and we know that we're not going to brush everybody's teeth, if they can brush their own, they will do that. We will only brush teeth for the people who can't brush their own teeth. And that applies to every skill that we do. So if a patient can bathe themselves, we're not going to bathe them. How awkward would it be if I showed up at your house at 5:30 tomorrow morning and insisted that you get in the shower and I was going to help you get cleaned up? I mean, that would be weird, right? So we don't help people with personal skills unless they need that help. If they can do it themselves, they will. So this is every skill that we are going to learn how to do. We only do skills for patients if they cannot do them themselves. And remember, there's 3 different levels here. There's full, which means that we do all the work. There's setup and cleanup, which means the patient can do the actual skill. They just need a little bit of help and accommodation along the way. And then there's ad lib, which means the patient does it all themselves. We aren't really involved in that. We also have to go over linen rules right here. So we're going to learn 2 more puzzle pieces today. In linen rules, we actually learned most of this just a few minutes ago. Remember I said that we don't want to hold the linens against our uniform? Because when you do that, you can accidentally contaminate the linens because your uniform is not clean once you start work. We also learned that our supply shelf is a one-way only supply shelf. So if we take something out, we can't put it back. If we either use it or we discard it in dirty linen. We also know that most of the time you don't have dirty linen directly in the patient's room. There's usually a room at the end of the hallway that's called soiled utility or soiled room. And that's where all the dirty stuff goes. We don't like, in healthcare, we like our environments to stay nice and clean. So we don't like having dirty items in the patient's room. The most dirty things will go into a special room of its own called soiled utility. Some facilities, though, that's a long way. If you have a hallway that's, way too many feet and the soiled utility room is way down at the end and you've got a whole lot of beds to make, that's a long way to be walking back and forth. So some facilities understand that, and they will actually have a soiled utility hamper in the hallway. Now, these things it's like a wire stand on wheels. It'll have a cover on it, and it has a light blue soiled utility bag in it. And that's where you're going to put your dirty linens. Now, the nice thing about this is because it's on wheels, you can wheel it right outside the room that you're working in. So it's really easy to transport those dirty linens and put them right in the basket. Now, the dirty linen cart cannot go into a patient room. Very important. Has to stay in the hallway. But you can bring it to the door, right outside the door of the room that you're working in. So we already know most of these linen rules, right? Linens must not touch your uniform. You have to have clean hands to get them. Don't let the dirty linens, unused linens must be discarded. So we know most of these rules. The three here, these three right here, we don't know yet. And we're going to be talking about those a little bit more on Monday when we learn occupied bed. But I want you to be somewhat familiar with them. Okay, so we're going to go over them here, and I'm going to go over them again on Monday. But don't snap or shake linens. Now, the reason for this is that patients that lie in bed, they shed a lot of things: skin cells, hair, yeast, bacteria, sweat, all kinds of things come off of a patient, and they're going to land on the bed. Now, when you snap a sheet, and we all do this at home, right? We go to put clean sheets on the bed and we just snap that sheet. And what that does is it creates a vortex. So this is a fun experiment for you to do tonight or sometime this weekend. Sprinkle some powder, baby powder, baking powder, cornstarch, whatever you have that's a powder at home. Sprinkle a little bit of powder on a sheet and then go snap a top sheet on top of it and watch what happens to that powder. It actually aerosolizes it. It brings it up off of the surface of the bed into the air right here, right about the level of your nose and mouth. Now, powder smells good. We don't mind that. But if that's dead skin cells from the patient, yeast, bacteria, and you're breathing all that in, that's not good. So in healthcare, remember that it's not your funk you're breathing in, it's somebody else's. So you don't want to snap the sheet over the surface of the bed because that's just going to aerosolize anything that might be on the bed. So we only unfold in healthcare. So you're going to unfold the sheet. So that's don't snap or shake the linens. We're going to skip the next one and go down. Don't let clean or dirty linens touch the floor. Now, the floor, and let me say, housekeeping does an awesome job. I love housekeeping in a facility. They keep our environments pristine, beautifully clean. And most of the time, you can just call them up on the phone and say, hey, I've got a spill, come help me. And they're so pleasant and so nice, and they come and keep everything clean for us. I love housekeeping, but we need to understand that housekeeping is very limited. They will mop the floor, but every time somebody walks on that floor, you're tracking pathogens from one patient's room to another. That floor is not clean. Even if housekeeping is doing a stellar job, that floor cannot be considered clean. So anytime dirty linens touch the floor, it's just going to further contaminate the floor. But even worse, anytime anything clean touches that floor, it is now contaminated. So even though the floor may look nice and shiny and clean, even though housekeeping mopped an hour ago, this isn't like at your house, where you can mop in the morning and in the afternoon, the floors still look great and there hasn't been a lot of traffic. In healthcare, we have a lot of traffic and a lot of different feet that walk up and down. And we have visitors that come in from outside, and we have doctors that come in from outside, and we have healthcare workers that come from different rooms. So those floors are not clean. Don't let dirty items touch the floor to further contaminate them, because then that's going to be spread to the next room. And don't let clean items touch the floor, because that's just going to contaminate that clean item. So now I want to go to the very last one that we haven't talked about. Clean rolls toward you, dirty rolls away. And you're going to hear me say this a couple of times in a couple of different skills. Clean rolls toward you, dirty rolls away. This is how we change linens. This is how we change underpads under the patient. This is how we put underpads under a patient. This is how we deal with anything that has to be changed on the bed. Clean rolls toward you, dirty rolls away. And I'm not going to get into that too much right now. We will cover it on Monday, but I want you to be familiar with that saying, because you're going to hear it again, and I'll be able to explain it a little bit more. So now we know all about linen rules. But there's a couple other things that we need to touch on here. So in a clinical facility, you may have a hamper in the hallway, but most of the time, you're probably going to be taking the linens to a separate room. We also have a clean utility room where all clean stuff is kept, and that's where a lot of your supplies will be. Sometimes there's a linen cart in the hallway with clean supplies. But anywhere you go, no matter where you work, you're going to have to go through an orientation period. And usually it's a couple of days. They're going to talk to you. The first day is usually about where to park, where to eat, how to clock in, who your supervisor is, and all that. Then they will put you with somebody that actually works on the unit, and they'll show you around and show you how things are done at that facility. Remember, always go back and read those policies and procedures so you know directly what the employer is requesting of you. So take the time to read those policies and procedures, but during orientation, this stuff will be reviewed with you. So you know that you're not going to have dirty linen in the room, and that poses a problem. Well, if you're going to take dirty sheets off of the bed and you don't have a hamper to put them in the room, what do you do with them? Because you can't just throw them on the floor. Remember, those sheets have pathogens. Anytime a patient's laying in bed, we shed things like skin cells and sweat and bacteria. And you don't want to put those sheets on the floor where all of those potential cells can contaminate the floor, because you're going to walk on that floor and you're going to go in and out of all kinds of patients' room, and even worse, at the end of the day, those shoes go home with you. So we don't want to just throw sheets, dirty sheets, directly on the floor. So what do you do? Well, in a clinical setting, the best thing to do, hands down, the very best thing to do, and what most of the policies and procedures are going to tell you to do, is to go get one of those soiled linen bags. So they're usually in the soiled utility room. You'll go in, you'll get one of the blue bags, you take it to the room with you, you open it up, and then all of the dirty things go directly into that bag. If you don't have a bag available, if it's an emergency situation, you got to change the sheets quickly because there was a problem, don't throw those on the floor. Go get a Chucks. Put a Chucks on the floor, put the sheets on the Chucks. That's acceptable as well. What's not acceptable is putting dirty items directly on the floor. That will fail you on the state exam. So, and I know we do it at home, right? And that's where the danger is, because this is something that, you change your sheets at home probably on a weekly basis, or maybe a little bit longer, but you change the sheets at home. And what do you do when you strip the bed? Well, we pull the sheets off, we throw them on the floor, and then we put new sheets on. But you can't do that in a clinical setting. It will fail you on the state exam. So if you've got in a clinical setting, if you've got a bag to put them in, that's the best option. If not, use the Chucks on the floor. But for the test, they're going to make this super easy on you. They're going to cut all of that away and make it so easy for the test. In the clinical room, and I'm going to turn this camera around so you can see. So over here is our clinical setting. And I know I've got tables in the way right now, but over here is our clinical setting. And you'll see that we have a privacy curtain, we've got a bed, and then we've got this shelf that has all of our patient use items on it. It's going to have sheets, towels, washcloths, privacy blankets, patient gowns, chucks, patient clothing, everything that we need to take care of the patient. And on the bottom shelf of that supply cabinet is usually a dirty linen basket for the state exam. Now, some evaluators may pull that basket out and put it at the end of the bed, and that's fine too. Doesn't matter where it is. They're going to show you when you go in to take the test. Remember, they give you that orientation at the testing unit. They show you this is where you're going to find your supplies. These are the hospital beds. This is how they work. This is what we use for privacy during the test. So they're going to show you around how to work everything and where to find everything. So in some cases, the evaluators will actually have this basket out at the end of the bed if the space is big enough that you're not going to trip over it. But when you start this skill, that's the one thing that you've got to look around to see is where is the basket or the dirty linen container, because you're going to put the linens directly in that dirty linen container no matter where it is. So for the tests, they're going to make it easy. There will be a basket or a container of some sort. You'll just put the linens right in it. In a clinical setting, do not put the linens directly on the floor. Put them in a dirty linen bag or at least on a chucks if you're going to put them on the floor, never directly on the floor. You might actually see that as a written question on the state exam as well, so keep that in mind.